Okay, my name's Dr. Chaand Nagpaul. I'm a GP. I've been a GP for 36 years in the same practice in Northwest London, serving a multiracial community. I'm here at APNA. I'm a great supporter of APNA. I think it's a fantastic organisation that brings together the whole spectrum of Asian professionals who work in a health service, medics, non-medics, managers, people in EDI, people working in the community. So it's great to be here. And I am also representing GPs and GP practices across Northwest London as chair of Northwest London Local Medical Committee. So I've been very involved in the changes to the health service at a regional level. And I've been speaking at a workshop here, leading a workshop discussing the 10-year health plan and what it means for the primary care workforce. The 10-year health plan is probably, in my view, the most ambitious plan that I have seen in my 3.5 decades of working in the NHS. It has three major shifts to move care out of hospitals into the community, and it's very explicit around doing that, with also very explicit targets to reduce the amount of NHS spend in hospitals and to increase the resource in the community so that people can be looked after at a much earlier stage upstream in their illnesses. But it also has a very strong focus on moving to prevention rather than sickness. And again, quite ambitious ideas around bringing in genomics as a standard at birth and then intervening so that people do not develop illnesses. So this is actually quite high-tech, forward-looking ambition. And the third is to talk about analog to digital, which is a shift which, again, is highly ambitious, talking about having AI as a tool that supports patients, the staff, having your NHS app as the front door to the NHS, ideas around digital actually providing care to patients at home rather than having to go to a hospital, to a clinic with wearables. So it really is speaking about a future a vision, which isn't what we see today, but it's a very clear roadmap. And I think what was really great about the workshop and what is important is that actually the government hasn't specified the hows. Now that's a failing in one sense because it's put forward an ambition without talking about the funding, without talking about the practicalities. But equally, by not having that detail, it's for us, I believe, as a profession, and that's what I wanted out of the workshop, to really put forward our ideas of the hows and how would we like to see these shifts develop in a way that improves the care for our patients and supports all of us as health professionals to be able to do our jobs with greater reward. And I think that's crucial. That's, no change in any government policy can be effected unless you have the hearts and minds of your workforce. That's where previous government policies have failed because it hasn't engaged. So this is a time that I think we as a collective profession need to come up with thought leadership about how we would like to see these changes occur. Because in fact, the changes that are being proposed, I don't think any of us disagree with. It can only be right for patients and people to be looked after in their communities rather than become ill and go into hospital. It's the right thing to do. As a GP, I see that all the time. I see so many of my patients who I know could be served better in terms of preventative health promotion, who could actually have interventions at an early stage before their illnesses get worse. So I see that in front of my eyes. I would like that to become a reality. Every day, I end up wasting probably an hour on IT that is out of date, where there's 5 keystrokes rather than having one, where I cannot see the information about patients who've been to a hospital, where in fact even a hospital cannot see the information about the same patient who might have attended another hospital in a different part of the country. In the future, what the NHS plan says is that there will be a single health record. It will reduce duplication. It means that you have the information you need in front of you about the patient to care for them properly. I think the role of technology and AI is a reality. Even in my own GP practice, we're using AI-driven tools to record consultations and transcribe them so that as a doctor, you can look at your patient, spend time communicating with them, whilst in the background, AI is summarizing the consultation. Of course, you've got to check it, but it is actually taking time that would have been spent on administration away from us. We have AI tools now that are registering patients, processing hospital letters, triage, And these tools, of course, have to be properly assessed for safety. We need to put in place measures around data protection, but it is the shape of things to come. So in our session, what was good was we discussed all these ideas. And in fact, we discussed how this might operate and the reality people experience. And I think the take-home message at the moment is that there is a disconnect, if I'm honest, between the ambition and the reality that healthcare professionals face on the ground. There is an ambition around this forward-looking agenda, but at the moment we have a health service that is, short of cash. There isn't even the resources for me to upgrade my basic IT equipment, let alone having AI tools. We have a situation where the country as a whole has a deficit in its economy. And in fact, you do need to pump prime investment to make these changes. And let's not forget also that we're at the moment in a health service that has huge backlog of care since COVID, over 7 million patients waiting for hospital treatments. And you can't move resources out of hospitals into the community whilst you also have to bring down that waiting list, which is a government commitment too. So I think there's a lot to discuss and a lot to challenge government about in terms of how it will actually be able to deliver on its vision in the 10-year plan. And I think it's for us as a profession to collectively, put to government those challenges, but equally come up with the sort of ways in which we believe this should pan out. One of the greatest strengths of UPNA is that it brings together health professionals working in the NHS across the various sectors. So you've got people in primary care like myself as a GP. There are other primary care professionals. You've got people working in hospital. You've got people working in the community. You've got people working in commissioning bodies like ICBs. You've got people working in health tech, in IT, in digital. And in fact, all of these elements are necessary together in actually shaping the NHS plan. So UPNA has a fantastic resource of the myriad of professionals and sectors, including the voluntary sector, that's also part of UPNA. So it has a myriad of all the players and stakeholders that make up the whole, which is the way in which the NHS operates. And therefore, what I hope we can do through UPNA is draw upon that breadth of expertise, the breadth of experience, the breadth of professional realities that people face. And I hope over the year we can have a voice in how the 10-year plan can shape. And remember also the other element of UPNA is that we are representing South Asian healthcare professionals. And we shouldn't forget there's also a part of the 10-year plan is about health equity. And we need to make sure that the plan develops in a way that is equitable for South Asians who work in the health service, but also equitable in terms of South Asians that we represent as patients in our communities. So even when you look at issues such as the digital transformation, we need to make sure that that transition doesn't exclude anyone, that it is culturally sensitive. We need to make sure that even shifts into the community are such that the service and care we provide in the community is again culturally tailored. It has the right focus. It is tailored to make sure that the differences in certain health conditions and the way they impact on different communities is addressed. So the 10-year plan doesn't actually go into that sort of detail, which is why I think a body like UPNA can raise its voice and show that if we really want to make a difference in health, it's of course important to achieve the shifts of the NHS plan, but it's also important to make sure that we ensure equity within those that work in the health service, but also within the communities that we serve, because ultimately, unless you make sure that you address health inequalities and racial health inequalities, you actually have a country that ends up spending much more on healthcare, actually. So it actually costs money by not having racial equality in care.